Well, good morning, everyone. Thank you so much for joining us. I'm Kate Warren, Executive Vice President and Executive Editor, sorry, my voice echoing here, at Devex, and we are delighted to be bringing this conversation, the sidelines of WHA, with the International Society for Nephrology on a really critically important but often overlooked disease, and that is around kidney health. We don't often see kidney disease front and center on the global health agenda, but that is starting to change. And it's conversations like these that are really helping to drive that change. As we'll hear today, the numbers are staggering. More than 850 million people are affected globally, and the burden is only growing. Yet awareness, policy attention, and funding have not kept pace. That's why this upcoming WHO resolution could be such a turning point, not only for those working on kidney health, but for the broader effort to prevent and treat NCDs. To set the stage for the day, we are going to have a couple of conversations with a wide range of experts and stakeholders. We will have a little time for Q&A in one of those discussions, so we hope that you can join and participate. But first, just to welcome us, to kick off the event, I'd like to welcome Dr. Marcello Tonelli, who's the president of ISN.
Morning, everyone. As you've heard, I'm Cello Tonelli. I'm the president of the ISN, and I'm so delighted to welcome all of you to this event. Those of you that have attended Devex event in the past, you know that the calling point, the key feature is let's get right to it. So that's what I'm going to do today. We have a great panel of speakers. We're going to get started. Again, thanks to all of you in the room today. Thanks to all of you watching online. Looking forward to a great conversation. Back to Kate.
Great, thank you. Well, in that spirit, I'm going to hand things over to my colleague, Rumbi Chakamba, who's a senior editor at Devex, who is going to be leading us in conversation about making the economic case for kidney health. So Rumbi, over to you.
Thank you so much, Kate. And can you please help me in welcoming our first speaker, Dr. Timu Wanganivalu, who is the founder and managing director of Action NCD International. Dr. Timu? Dr. Timu, thank you so much for being here. So Kate kind of, first of all, started talking about the numbers, and I was actually quite shocked to come across this statistic. Let me read it to you. Kidney disease is the third fastest growing cause for global death, death globally. I didn't know that until quite recently, so I was shocked to hear that. But it seems like in this moment in time, money talks. So Dr. Timu, how can we make the case for investing in NCDs in general?
Thank you, and thank you very much for the invitation to be here. Very special topic in the whole NCD space. Money talks indeed. When we are talking with the Ministry of Finance, money does matter, but we've realized that life does matter to them as well. The main issue about non-communicable disease is we cannot afford to not act on it, and I think that's part of the motive here. And the cost that comes not just for health but also economically. Decreased productivity, the healthcare cost that it actually brings, the inability of people to partake in economic activities is part of the economic burden that is actually there. When we are advocating with the Ministry of Finance, they do care about lives not being saved. I was talking with the Minister of Finance in a country when we're advocating for tobacco tax and SSB tax. At the end of the conversation, his main comment to me was, Dr. Don't worry, we'll do this. Yep, no problem, we will do this. And the main reason for it was because tobacco tax is actually affecting the youth and the poor. And so it's pro-poor in that sense. So they do care about lives being saved. But they also do care very much about money being saved. And I think that's an important imperative to bring forth as well. In Vanuatu, 1.3% of the population, if you give them their full treatment of diabetes and insulin, you run out the whole pharmaceutical budget in 3 months for everyone. Right? When you present that to the Ministry of Health, it's kind of the norm. But when you present it in front of the Ministry of Finance, they lighten up and they said, this is interesting because now we can save all that cost by the expensive treatment if you prevent it and so on. So I think money does matter to the Ministry of Finance, but life does matter to them as well. And so we need to come into that space, economic space, quite early. And it's an investment for health. We need to stop just requesting money for diseases, but strategically position ourselves as an investment for health going forward. I think is the lessons we've learned from them.
Yeah. And in terms of this, how can countries integrate NCD care into universal health coverage in a financially sustainable way? I'm assuming integration probably makes more sense economically.
Definitely. The integration is a nice buzzword. The issue is everybody talks integration, but no one wants to be integrated. And I really think we should get that lesson in. And I telling Tuli that, yeah, as long as nephrology is part of NCD, it's great. The problem we had with NCD was that it's 4 big diseases, 4 big risk factors. Yeah, too many, too much. You have 100 things to actually implement. And so the first point was to actually prioritize. And we didn't have a prioritization tool. When UHC came into the picture, then incorporating non-communicable disease into universal health coverage package was part of the main challenge or main task that we needed to do. And so we take whatever is happening at the global to incorporate it into a national prioritization process was a big challenge. Most of the developing countries, their prioritization for health is implicit, right? The minister decides, the best they might speak to that to some extent, and they go through, but there's no explicit process to actually do the prioritization. And even when it's time to prioritize, the NCD come with this big plan. It's not costed, and even when they tried to cost it, it kind of came up more than the GDP itself for the country. So tools needs to be made available, take economic and health data locally, and help prioritize the interventions that we need to do at the country level. I think that's the key part of it. And when you do so, if it's an implicit process, at least start with the heavy burden, with those that bring good impact. The focus on primary health care is key because that prevents you from the expensive treatment and the secondary and tertiary level care. But that prioritization process needs to happen. On the financing side, health promotion tax has become quite a good thing to pursue. It's a win-win-win situation, as you would have heard. But some of those financial incentives needs to be put in place as well to be able to cover for the gap. The national insurance package needs to be extending to the NCD areas as well. But in order to get there, this prioritization process needs to actually happen, and strategic choices need to be made.
You've actually answered my, I think it's third question now, but I will re-ask it in case there's something else that you wanted to add to that. You've spoken about how difficult it is to integrate, but we always talk about integration. So what shifts are needed in national policy frameworks as well as global policy frameworks? You've spoken about some already. Anything more you'd want?
Yeah, there needs to be a good strategic shift from being reactive to actually strategic financing. I think that's one shift that needs to be made. Also, the move from donor-driven or donor-funded initiative into domestic. I think that's 2 key strategic shifts that needs to happen. We need to be talking investment rather than trying to get money for diseases. But the domestic financing, I think, needs to be highlighted. To me, financing is ownership. And when your disease program is mainly financed by external, you don't own the problem, you don't own the solution. So we talk with the countries. I was talking with the Director General of Health yesterday. I said, we've got this package. It's cost about 300 per participant if they join it. But we bring it down to you for $30 per participant. He looked at me and he said, who is going to pay for the $30? I looked at him square in the eyes and said, the Ministry of Health. Right? When I talk to some of the Ministry of my NCD colleagues and they said, can you do this? And they say, we don't have money. I said, of course you have money. The minister is traveling around, you buying cars, there's money in the Ministry of Health. The challenge is you haven't had the ability to actually advocate and get that money wherever that is. So domestic financing to me is absolutely key. And also, money follows solutions. And so I think the quicker we get into some tangible solutions that investors are ready to put their money to, the better. We had a meeting one day in one of the conferences, and when the best buys came into place, we presented that. Straight after the meeting, one of the multilateral funders came across to me and said, this we want to fund. The more specific you get, the more solutions you have that are clear, the more it will also attract the funding. So I think that shift actually needs to be made. I've talked about the investment part, but on the actual, this component of it, this domestic financing, it needs to be done. And so the international still has a role though, because the domestic financing is not going to be sufficient to actually do it. And the need for an international financing mechanism to drive the whole NCD agenda, including kidney health, is still needed. We are on the initiative to do that, establish that globally, Global Foundation for Action on NCD. Very happy for the society to join in that force, because it's still needed to bring some catalytic effect to the countries, but also to add on to what they are supposed to be doing. But the domestic one needs to be kind of upfront first.
Thank you so much. And final question, how can resolutions like this one actually help with transformation? I'm always so worried that we come here, we discuss resolutions before they happen, they're passed, and then thereafter it's like crickets.
Yeah, I've worked in the WHO for about 17 years. Resolutions no longer excite me because there are a whole lot of them stacked around there. But it's an excellent tool though. I always tell our technicians, don't blame the politicians. They've done their bit. They've talked, they've signed. Now you take that document and you use it to advocate and push for the agenda at the country level. I think this resolution is great. I was telling the president that whenever I go to countries, the one thing they keep harping about is this dialysis cost, you know? They don't talk about the cardiovascular, they talk about this. It just seems like kidney is that front and center of the cost factor in the whole NCD space. And so this is coming quite very timely. I think what we need to do is actually take this and use it to the max of it. It's both a consequence, but I think it's also a catalyst for the NCD agenda. I'd really love this on board, because now I've got an answer to all of these dialysis complaints that they keep coming about, because this answers that directly. So I think this resolution will really be a catalyst for non-communicable disease and help in the different parts, from funding to implementation to primary health care to the visibility of it. But it all depends now on the countries to take that and actually run with it. And so on the ground work needs to be done. Just to put an example, the best buys that we've done in NCD, we've already got some component of kidney health in there. The challenge at the moment, the last bit of work to be done, is that at the country level, we need to develop country best buys. At the moment, they exist at the global level. And what some of the countries do, they take the global one, copy and paste into their strategic plan, and they try to run with it. We now need to go into country, and this is part of the work we do, is to actually take health and economic data on the ground, analyze cost effectiveness, come up with those country best buys in order to make it run. So it's at that level that this resolution is going to be effective if implemented well.
Thank you so much, Dr. Timo. I think you've given us all a lot to think about. And at this point, we'll hand over back to Kate.
Thank you.
Great, thank you. So we're going to continue this conversation, and I'd like to invite our panelists to the stage. We have James Anderson, Executive Director for Global Health at IFPMA, Brian Kennedy, Executive Director, Global Alliance for Patient Access, Secretariat to the Global Patient Alliance for Kidney Health, Marianne Sukyar Nielsen, Founder and Chair of CompCure, and Dr. Marcello Tonelli, President of ISN. So please come join me on stage. You can sit wherever you like, wherever looks comfortable. Thank you. So we're talking about this kidney health resolution, and as Rumbi alluded to in our previous conversation, there's many resolutions that come out of WHO. And Dr. Telly, I want to start with you. And you were expected to see a vote this week on this proposed resolution that will formally recognize kidney disease as a priority NCD. So what do you see as the importance of this resolution and really solidifying kidney disease on that agenda, and how then that can translate to actual implementation on the ground?
Great question. So as you know, kidney disease, common, deadly, preventable, and treatable. So common because it affects about 1 in 10 of us, 850 million people around the world. Deadly because it's the third leading cause of death in terms of its rate of growth, and because millions of people die every year because of lack of access to kidney replacement therapy. And preventable because for the first time, we have the medications we need and we know how to deliver them at scale to prevent kidney failure and improve health. But if you think about, that's a problem statement. So how does a resolution help with that? And I think there's really 4 or 5 buckets by which this really amazing resolution, if acted on, as Dr. Timu told us, will make a difference. And the first is about putting kidney disease into national NCD control programs. So that has lots of benefits, but I think the biggest one is probably attention to workforce. A lot of the countries we go to, there's a critical shortage. I recently met a nephrologist who has 25,000 outpatients, and that blows my mind. We can make a difference there by putting kidney disease into those plans so we train the doctors of the future. The second is that if done properly, if implemented well, this resolution will unlock access to the simple, cheap diagnostics and the effective drugs that we need to make a dent into the burden of kidney disease. And the third is related, which is that with attention to early detection and timely treatment, we can catch people early, we can get them the treatment that they need before it's too late. The fourth is that, if we really look at kidney replacement therapy, as I mentioned, millions of people die each year. If we can unlock access in countries where that makes sense, and especially to kidney transplantation, the preferred form of KRT. And last, maybe not very sexy, but we know that what gets measured gets done. And we know that we are not measuring the things that matter. This resolution calls on member states everywhere to measure the outcomes, the burden, access to treatment, and how, above all, how we're doing, the progress that we're making. So we applaud Guatemala and the other member states that sponsored this resolution. We think it's going to make a huge difference. Yes, resolution just needs to be voted on, but we want to get to that stage, and then we'll get to work on the hard work of implementing it.
Thank you. And access, one of the challenges is just financial limitations. And I think we're in a very financially constrained environment. There is often this sense of even a zero-sum game between different health priorities and how you prioritize them. And James, I want to bring you in from an industry perspective. What policies, collaborative approaches do you see the private sector can bring to help increase access to many of these therapeutics that are available but harder to reach in low and middle income countries?
Thanks very much. It's really a pleasure to be here. I'd start by saying 25 years ago, when I first joined the industry, I launched a product for kidney disease. It was for end-stage kidney patients, because at that time, that really seemed to be by far and away the focus. Since then I've worked in a number of other disease areas, but it's a really pleasure to come back in a way at such an important time where the debate has completely shifted, or largely shifted, to prevention, screening, early detection, and slowing the progression. And that's obviously a game changer in terms of a quarter of a century. I feel very old. The point is, first of all, I mean, I must congratulate the member states who are here, who've sponsored the resolution, and really good luck for later today. But the innovation that has come out of the medical experts Nephrologists, I remember, were the super specialists at the time, and I'm sure are today, because of the complexity. And a lot of what you've said, the understanding now enables that management to be done so much more effectively to prevent patients reaching end stage, which has to be the goal in order to have any chance of making it sustainable. So many of the innovations and the products that help to do that now are have moved a long way and have contributed to that understanding. The research that companies have done has made a big contribution, I believe. But we absolutely need to make sure that the products are available to all patients who do need them, because otherwise you're in the catch-22 of if you diagnose patients but you can't treat them, then you're really stuck. So we want to make absolutely clear that ensuring access to those medicines, it has to be a critical part of the resolution and the political declaration later in the year, etc. So what does that need to look like from our point of view? I mean, we can go in more detail, but in a simple way, we would like to see countries, as they do implement the measures in the resolution, pulling the products through more. So when there is a better understanding, when there is better data of the population of patients, there should be a strong signal back to the industry to say, this is the number of patients we want to treat. It hasn't really happened even with diseases like hypertension, even diabetes, where actually it's quite binary and easy to count. And what that should do is unblock the pathway that that companies have to work with in order to try and push the medicines through. We want to change the paradigm a bit so that it's more like a push and a pull. So let me pause there. I'm happy to come back in follow-on questions, but in a high level, this is such a good step. We think it really could open up this area, and that's how we would like to see part of the shift.
Yeah. And Brian, I want to bring you into from, thinking about how patient advocacy and again, these resolutions are done at a high policy level. And so where do you see the role of patient advocacy and really driving the momentum and particularly getting this adopted within member states, again, in particularly low and middle income countries where we know there are many challenges?
Well, thank you. Thanks to Devex for putting on this forum. Thanks to the International Society of Nephrology and the sponsors of the event, really to put the focus on kidney disease on a very important day where this resolution is coming forward. And, really applaud the International Society of Nephrology for its leadership in this space. This resolution wouldn't be happening today other than the fact that it's very concerted and focused effort to work with member states to get a resolution put forward. And you think, well, another resolution, how difficult can that be? I cannot believe how many meetings I attend about NCDs where nobody will say the word kidney, okay? I can sit through a heart summit over the course of an entire weekend talking about the burden of cardiovascular disease, and nobody will utter the word kidney. I can pick up the zero draft resolution, political declaration from the high-level meeting on NCDs to be convened in September, and the word kidney is not spoken. So it's leadership in advancing something like this resolution here at the World Health Assembly that will help us ensure at the national level that advocates are equipped to ensure that kidney is part of the broader discussion about what we're going to do about NCDs, and in particular, cardio-kidney metabolic conditions, which represent over half the burden of NCDs. And we know it's a burden that's growing very quickly, going to double in the next 5 years or so. And we know that kidney is the aspect of that that is elevating fastest. So as advocates, the patient advocacy community, so the Global Patient Alliance for Kidney Health, representing 35 different national kidney health patient advocacy organizations, servicing tens of millions of patients with chronic kidney disease and rare kidney diseases, to be equipped with the resolution of the WHA as they approach their national policymakers with the ask of the focus has to shift to early. Early meaning we start with prevention. What are all those things we can do to ensure that we're preventing people from having cardio, kidney, metabolic conditions? We recognize the burden in this, and there's much that can be done. And then early, which means vigilance, which means access to screening. And how do we move screening beyond the clinical setting to the community setting? How is it that we're empowering patients to really be setting the agenda at the primary care level, to be seeking to be screened where they're at risk for these different conditions? How is it that we equip primary care and community-based care, create the capacity in there that we actually can help these patients? I don't know how many times I've heard this scenario from patients, from a kidney disease patient who's progressing towards late-stage kidney disease. You know, for years, I've been treated for diabetes. Nobody once ever screened me for chronic kidney disease until I'm, you know, being directed to go to dialysis, right? Hear that time and time again. The patient who's newly diagnosed for chronic kidney disease, but who had never had been tested once for hypertension because their general practitioner just didn't have the capacity in 7 minutes to say, oh, this is some way we had to test their hypertension. Our healthcare system is about to be overwhelmed with a tsunami of patients with NCDs, and in particular chronic kidney, cardio kidney metabolic conditions, and a lot of that being fueled by chronic kidney disease. If we keep on the same course of basically kind of a healthcare system designed in the last century to deal with the challenges of today, we are going to be overwhelmed. And it starts with changing the framework that we think about these things. We have to address it early. And so the WHO resolution, hopefully adopted within hours, is just one more way we can advance that case at the national level where the change has to be made, but also to call for a much more bold and clear declaration in the political declaration for the high-level meeting on NCDs that has kidney squarely listed there amongst the significant NCDs in that frame, with cardiovascular, cancer, respiratory, and the others as well. So I'll stop there.
Yeah, I mean, if 1 in 10 people are impacted by kidney disease, it goes to everyone in this room must know someone. I lost an aunt to kidney disease, and I'm sure everyone. So I think more you can connect to the human and the person on the other end is important for that awareness. And Marianne, you know, you're the mother of a child living with rare kidney disease, and also my daughter was just 2 months ago diagnosed with type 1 diabetes, and actually have ISN to thank for recognizing the increase now she has in kidney disease and be able to have that top of mind. Not everyone necessarily has that information, but it makes those threats really real, right? When it's your child. And so what would you like for stakeholders and policymakers as they're thinking about this resolution to think about as really centering the patient and how we're formulating these policies?
So thank you very much. I think it is absolutely critical to have concrete plans. And there should be a specific focus on early detection in these plans. Kidney diseases are silent killers in many cases. You can be affected by kidney disease and not know about it. And by the time you feel that something is wrong, it's late. And that's why I believe that screening programs would be a good thing to explore. But it's not enough just to know that you have a kidney disease. You need to know what kind of kidney disease you have. And if we just look at Europe, more than 30% of the people in dialysis, they actually don't really know what kind of disease they have. There are 300 rare kidney diseases, and probably a lot of these patients have a rare kidney disease. The issue is that if you don't know exactly what disease you have, it becomes very difficult to treat it. So this is absolutely important. It is also important that there is access to care, timely access to care, while there is still kidney function left to preserve. And by care, I mean access to therapies, and I also mean access to the right level of expertise, which is again extremely critical in rare kidney diseases. Finally, we need to make sure that there is access to transplants for the people that have already progressed to end-stage renal disease. There has been a lot of arguments related to awareness, and I think this is also an incredibly important topic. It is important that there is focus on kidney diseases and the associated complications. Organ systems, they don't work in silos. If you have a problem with your kidneys, you run the risk that pretty much all other organ systems are impacted. So we need to make sure that there's awareness about this. And I have brought a picture that we can show, maybe.
There it is.
Good. This is my daughter 6 years ago. She had a stroke. She had sepsis. We spent 2 months in hospital. I was not really sure if she would survive. This is a very expensive situation also, and of course devastating. We can show the next picture. This is what she looks like today. And she looks like this today because we have access to excellent care. But this first picture is a situation we need to avoid. And if Esther would have been tested years earlier, I'm pretty sure that we would have detected her kidney disease and we could have treated it earlier and much more cost-effective also. So the need for early detection and timely therapeutic interventions is real, and that needs to be taken into account whenever we implement the resolution, hopefully, in the future. Thank you.
Thank you. So I think that beautifully illustrates, again, the importance of this issue and the people that often get lost in these conversations when we talk about, a disease and the impact it actually has. And that's why we're here, right, for people. So I want to talk about that early screening, early diagnosis, and what is some of the challenges for being able to access that, and then particularly in Europe, even having trouble accessing the screening that you need. If you think about low resource settings, that's even more challenging. So James, I would love to hear from your perspective how you see governments and civil society and also private sector pharma working together on some of that accessibility challenge.
Yeah, thanks. Well, thank you for sharing the story of Esther. I think that just brings it home so much. Look, what I would say, I think I'd just say two things really briefly because I know we're running out of time. One is companies are doing programs in different ways to try to help. And I think that those, and a number of the companies are here in the room and they're active with the societies. And I think that's a really important part of what we can do. But it doesn't solve it. And I think what we've been talking about, I really agreed, Dr. Timo, how you described it. So the other thing I want to share was in this room on Monday, we heard from a Japanese minister of the program that they've been rolling out over the last couple of years in Japan. And okay, that is back in a high income setting, but I think it's a sort of a benchmark that shows what can be done by making it a priority, by measuring the incidence and the progress, by integrating it, delivering it as part of an integrated primary care setting, which does have screening for across all of the linked cardiovascular diseases that you've talked about. So that's I just want to share those 2 points really, because I think those point the direction that we know we need to move in.
Well, thank you. Unfortunately, this is time we have for this panel, but thank you all for sharing your experiences, and particularly from these different perspectives, because we know we need all stakeholders working together to be able to tackle the kidney health challenge as part of the broader NCD challenge. So thank you all.
Thank you.
I am going to Actually, I think we are going to just take a minute before our next panelist is ready here. Yeah. Oh, so I think actually if we do have any questions in the audience, we actually can take, I think we're, let me see, raise your hand if anyone had a question. Yes, right here, and then we can get you a microphone.
Thank you very much, and thank you to all the panelists for your wonderful talks. My name is Fiona Loud. I'm from the UK, but I'm here with the ISN, with GLOPAC and many others, and I'm also Director of Policy for the kidney patient support charity Kidney Care UK. And I also have spent 5 years on dialysis, and now this is nearly the 19th year of my transplant. So my question really to the panelists and to everybody here is, kidney disease, it's a silent epidemic, but it is very, very loud to the people like me and the people we support who are experiencing it. We have a situation really, which we often call double running in the UK, where we have to support those people who are on dialysis, who are living with a transplant, who, it is a very expensive treatment, but at the same time, we want to promote the prevention agenda. We really want to make that word kidney stand out in a way that very dangerously and very disappointingly it hasn't done in the past. So my question really is, what do we tell patients will happen if this resolution is passed today? We're very excited for it. And what can we take from that back to our own government, because they sometimes listen to the patients and professionals together, that will change as a result of it? Thank you.
Thank you. Well, Brian, I might call on you to tackle that from a patient perspective. Yeah, thank you.
This is like a colloquy that we're going to have. Look, I think that the value of that resolution is it really creates the context for the conversation that has to happen at the national level. And we saw, to sing Fiona's praises, she organized a session at the European Parliament last week. At the UK Parliament last week. We were there in London, where we sat down with 4 members of Parliament. We had the entire kidney health stakeholder community there. So the patient advocacy community was there, the nephrologists were there, the general practitioners were there, the pharmacists were there, and we shared lived experience, we shared evidence with the MPs, and really making the case for why early is better. Why it is that if we can address this through access to screening, early diagnosis, and early treatment, the burden it will release, the release of the burden on a stretched to capacity healthcare system right now will be enormous and really create additional capacity for them to deal with other needs that exist. So that, we recognize the high cost that is associated with dialysis and transplant, and really the interventions are used in kidney disease today, that if we can prevent the progression of kidney disease through access to therapy by early diagnosis, that can have a real payoff to the healthcare system, benefits patients, benefit society as a whole, and benefit our climate. Oftentimes we don't talk about climate in the context of healthcare, but 5% of the global greenhouse emission comes from the healthcare system. Chronic kidney disease alone, the amount of CO2 released in utilizing interventions like dialysis, et cetera, is equivalent to 17.7 million cars on the road each year, the amount of CO2 that's produced. We use, I think it's 169 billion gallons of fresh water a year in dialysis, resulting in something like 1 billion gallons in medical waste each year. So at a time where policymakers are thinking about these things in the broader context too, we can make a benefit on the climate. So these are types of things that we're sharing with policymakers at the national level. And the resolution gives us one more opportunity to say, let's have a conversation. There's things that can be done. So next question.
Thank you. Marcello?
Just wanted to thank, that was a terrific answer. And I want to congratulate Fiona on all the work she's done in the UK. One of the things I really appreciate about this resolution is it allows countries to start from where they are. So the answer to the question, what can patients expect, I think also in part depends on the context. Everything that we heard about from Brian is directly applicable to the United Kingdom, to other high income settings. For a lower income or middle income setting, the emphasis may be different. It may be as simple as providing additional healthcare workers so that we go beyond that doctor that has 29,000 outpatients, or the country that has 4 nephrologists to look after 10 million people. So that's the beauty of the resolution, is that it fits all contexts. And I think that's what we should be saying in part to policymakers is, what's your priority locally, and how can this resolution be made to work for you? Thanks.
Thank you. So thank you so much. Okay, do we have another question, or no? Okay, we are going to move on to our next panel. We're actually going to look at the role of member states, and so I'll invite my colleague Rumbi back to the stage to lead our next discussion. Thank you, Rumbi.
Thank you. And I'm glad to invite on stage some countries that have actually been championing this resolution. Please help me in inviting Dr. Galil Abdajalil, who's the Director General of the Ministry of Health of the Federal Government of Somalia, as well as Associate Professor Warangana Piachong, who's a nephrologist at the Rajaviti Hospital in Thailand. Please come and sit right next to me. But before we jump straight in, we have a video from Guatemala.
Dear colleagues and partners, during the last decade, Guatemala and other countries worldwide have experienced an exponential increase in kidney disease incidence and mortality. This incidence has been higher among the socially and economically disadvantaged sectors of society. The risk of kidney disease is higher among patients with hypertension and diabetes. These two diseases continue on the rise and play a major role in the increase in kidney disease incidence. In addition, Guatemala and other countries have now documented an increase in chronic kidney disease of non-traditional causes. These diseases have been documented to be higher among rural agricultural communities in low and middle-income countries. Thus far, kidney disease has not received the attention it deserves, considering the human and economic burden it has. Therefore, Guatemala has taken the lead in proposing the first ever World Health Organization resolution on kidney health. In doing so, we aim to increase kidney disease awareness and surveillance. In addition, that we all have access to prevention, diagnosis, and treatment of kidney disease in every country, regardless of income. During this process, member states from every region, WHO technical teams, civil society, and patient advocates have been fundamental in making sure this resolution represents a comprehensive approach to kidney disease. Among the many challenges we face is gathering worldwide support so that every country can recognize kidney disease as a global health threat. In recognizing kidney disease as a public health threat, we will join forces in the fight against cancer, heart disease, diabetes, and hypertension. These chronic diseases are already recognized as major killers worldwide. If the resolution is approved, we must gather the political and social support among patients, healthcare advocates and providers, governments, and civil societies locally and internationally. Guatemala remains committed to supporting the next phase by sharing our lessons learned. Even though I regret not being able to attend the assembly in person, I am thankful to all of those who have worked on this resolution, in particular, the Kingdom of Thailand, our co-sponsor and leader in this field. Finally, let us continue working for a healthier society together. Thank you. Muchas gracias.
That was perfect to kick us off. So both Somalia and Thailand have championed this resolution as well as co-sponsors of it. I want to find out from you guys, what was your country's motivation in pushing for this resolution? I'll start with you, Dr. Guled.
Thank you. Just want to start by thanking those who organized this important event on related to discuss on a very urgent and high burden issue on low income and middle income countries and even high income countries. So this was a very challenging issue globally, as you know, nearly almost 600 million people have been facing the kidney disease globally, and almost at national level, each country feel the burden of the kidney disease. So for us, Somalia, as a low-income country and a fragile and conflict affected setting country, you can understand where the health system is fragile and the cost of living is high. The burden of kidney disease, how can the population it affect? So, for example, entire Somalia, when you look at the dialysis centers, it's a number, almost nearly 15 million people, when they have only just 3 to 4 dialysis centers across the country. And the burden of the kidney disease is high, mostly caused by the chronic disease like diabetes and hypertension. And the high of out-of-pocket cost is higher again. You can feel the burden. So as a country, we have been struggling to cover the primary health care. So, and NCDs, including the kidney disease, was not part of that effort. So if we see the opportunity that bring in the attention and recognize it as a global issue, we should be front to be part of that movement, because we feel the burden at home. We feel the burden of the cost of the treatments at home. And when in Somalia, the dialysis treatment is limited. The cost of the dialysis is high. So you, for example, the Minister of Health is established and commissioned the first national dialysis center 2 years ago, the past 3 decades at the capital city of Somalia. That means before that, people were struggling if they had the chronic disease, if they need such kind of treatments of RRT. And the centers that has been established, again, it's not, it's overloaded when you look at the burden. It can't be covered. So we see the opportunity as if there is a global effort, we should be part of that movement. Thank you.
Thank you so much. And as a resident of Africa, I totally relate to the treatment costs and the lack of treatment services available. I was so encouraged by Esther's story, and I like seeing stories like that because for me personally, I believed that kidney disease equaled a death sentence, and that's mainly because of where I live. It took a diagnosis for a friend who lived in a different part of the world for me to understand that no, it's not necessarily death sentence. And I have to confess, I tried when I first heard about this, I played the part of an encouraging friend, and I was like, okay, no, you can get through this and whatnot. But in the back of my mind, it just spelled death. And it took that experience for me to realize that it's not necessarily the case. But I want to come to you, Professor Warankana. Can you tell me what motivated Thailand?
Thank you for having me to join this very important event. Kidney disease is a growing global health crisis. In Thailand, we have very high prevalence of CKD, which we have a study that we have the people that get involved in CKD around 17%. But by shockingly, just only 1.9% that aware that it has a kidney disease. This means the vast majority living silent treated. So Thailand took this action to address the resolution to shining the spotlight in kidney disease by early screening and early detection and more effective treatment, and moreover, to greatest access to care. So this effort also strengthening the national collaboration within, we have to cooperate and allowing the country that have similar challenges to cooperate and work together and sharing knowledge and save life.
Thank you so much. And Dr. Abdul Jalil, you spoke a lot about low-income setting. How can the resolution actually help low-income and middle-income countries like Somalia to strengthen primary health care? And how do you envision it actually being implemented?
I think first, the perspective of member states on this resolution are shaped by interplay complex factors. It might be economical, it might be infrastructure, it might be epidemiology, it might be cultural. For countries like middle income and low income countries, they see on the perspective of this resolution, first it brings a silent killer, the attention of silent killer to the global stage. They focus, when you look at on real issues on the kidney health, to have the preventive measures and the early detection and the screening, and I think the resolution calls fits most of the prospective varieties of the member states. For example, high income countries, they focus on advanced treatment and the innovation, and the resolution calls all the approaches that can be addressed in this global issue. But for us, as a low-income countries, we see if we want to address the NCD, including the kidney health, we should find to integrate these into the primary health care services. Unless, although most of the low-income countries are dependent on donor funding, and it should be difficult on the implementation-wise, but bringing the attention and recognizing this challenge, I think there is opportunity where low and middle income countries have the opportunity to get the support they require, whether it's a technical, whether it's financial, whether it's a human resource. So for us, even in the executive board meeting on the early of this year, we call on that as a low-income countries and most of the countries similar to us, we need to recognize this issue as a primary, as a challenge that should be integrated into the primary health care. Because, for example, the EBHS services we provide on the primary health care does not cover the NCDs, including the kidney disease, because of the high cost expenditure. Therefore, if we want to address, we should integrate first and think about the affordability and the low and reducing the high cost of pocket expenditure. All these are the competing issues that come in ahead of us. Again, if we want to address also, it should be tracked on the national health information systems. Now it's not part of that indicators that have been tracked. And again, low-income countries have not the opportunity to acquire and purchase on advanced diagnostic tools. So I think the perspective of calling even in the pharmaceutical industries to balance the innovation of the diagnostic tools and incentivizing of the affordability of that product it's also opportunity for the low-income countries. So I think, although the perspective of member countries, member states are different, but this resolution fits all the perspectives. That is what matters. For high-income countries, it should, their focus and concern is addressed in the resolution. For low and middle-income countries, their perspective and concerns also addressed in the resolution. So I see opportunity of recognition of this challenge and bringing attention will be in the interest of the all member states.
Thank you so much. Professor Warankana, Dr. Gulad spoke about early detection and integration as well. Can you share with us some successful approaches from Thailand and also how you envision this resolution being implemented?
Thailand has taken real action to fight chronic kidney disease in resource-limiting setting. We introduced the integrated care program that has been proved to benefit for delayed kidney disease in the study ESCORT-1 and ESCORT-2 over 3 years. And this is a community-based study and running in the rural area and use existing healthcare team, which is not a specialist. We have general practitioner, nurse and pharmacist and nutritionist to take together like multidisciplinary team. And we also use the village health volunteer to a local people that can help the neighborhood, and we do a home visit regularly. So at first they work without pay, but now the government see and recognize the essential role of the village volunteer, so they get paid bi-monthly. So this is a program. It's just not good for health, but good for economics also, because the national study about the causes can save 7% of the total Thailand health budget, or over 200 billion baht over 5 years. So Thailand model is proof that if we have the right approach to the kidney, we have to better care and lower costs, and then to have a healthier future health.
Thank you both so much. Unfortunately, we've run out of time, but I think we should definitely be discussing this more. So I encourage you to stop, have coffee, and chat a little bit more after the end of the session. But for now, I'll hand over to Kate.
Great, thank you. Well, thank you all so much. And Marcello, I don't know if you have any closing words you want to say here, but I think that, these conversations really help bring to light just why kidney health is such a critical component to overall NCDs, and why this resolution is so important to really give a roadmap to help countries and civil societies and healthcare systems think about how to better integrate kidney health into their programs. Really thinking about affordability, equity, UHC, all really is at the heart of this. A lot of conversations this week at WHA are focused around how can we get more bang for our buck when there's limited resources, and I think it's pretty clear, and we laid out some good economic cases for why investing in kidney health is good bang for your buck. But thank you to ISN for co-hosting this session with us. Thank you to all of you who joined, both here in person and online. And Marcello?
I'd like to thank Devex for putting on a great event. We had a really terrific spectrum from excellent policy, technical components to inspiring patient stories. I thought was really well done. I'd like to echo the thanks to people that joined us in the room and online. I'd like to thank our sponsors, AstraZeneca, BI, and Novartis. Thank you so much. And really at this point, our job is to thank the speakers. Thank you to everyone for making the time to be with us. And our job at this point, as Dr. Timo told us, we want this resolution to pass. We congratulate Guatemala, Thailand, and the other member states. Thank you so much for your leadership. But that's just the beginning of this journey. We look forward to working on implementation with all of you. Thanks so much, and enjoy the rest of the World Health Assembly.
Thank you.